All righty, y'all. So today we've got Zach Thomas on here again and talking about our December reflection. Anybody that's been kind of following the channel throughout December knows that A, I wasn't really putting out a whole lot of content, and B, my December was quite challenging. A lot of different speed bumps and road bumps that kind of had to take me away from the residency, just things going on in life. But so I don't really have much to say from a residency reflection standpoint other than I'm excited to be getting into it coming into January here, and feel like I'm actually a physical therapist and doing residency again. So hopefully we can hear a little bit from Zach, and hopefully his experience in December was a little bit better than mine was.
Yeah, how's it going, everyone? Thanks for having me on again, Jonathan. I certainly can't top the December you've had, but I also had some time off as well. So again, not as much time in the clinic. I was off for about a week and a half for the holidays, which was nice. I was able to go home, see family, friends. So that was kind of a nice little getaway. And I felt like it came at the very opportune time where it was just kind of that 3.5 months in, getting really into the swing of things, starting to get overwhelmed, and then able to step away for a little bit. So that was very refreshing, and coming back was kind of like felt like a new start a little bit, which was good. And having said that, it was and still is a little bit harder to get into that groove again because you kind of get used to that home life again and just relaxing, and then you're like, oh, I gotta go back to work kind of thing. But luckily, being in this field and just something that I really enjoy doing, it makes it a lot easier to get back into it. So that's always a bonus when you enjoy what you're doing. But since I worked 4 days this past week because we had off for New Year's Day as well, but nice to get back in the groove of things. Threw me right back into it. Had 12 patients on the Monday I got back. So
nice.
Just like I never left. But things are going well as far as residency wise. Things are starting to get a little bit easier, and documentation wise, getting a little bit more familiar with it. I'm certainly still taking notes home. But I was talking to one of the other therapists who was a past resident, and he said during his residency, he was like a month or two behind in notes. And now he never takes notes home, and he just bangs them out. And so I was like, so I guess there is light at the end of the tunnel. It will get better. And he was like, yes, just stick with it. And it'll get easier. You'll just get more comfortable with what you're saying. So that's still something that's kind of a day-to-day challenge for sure, is trying to be as efficient as possible so that I don't have to bleed it over into home as much, and kind of separate home and work, and then also have the home time to work on some of the other projects within the residency program. So specifically, the one that's assignment we have due coming up this next week is getting the organizational plan together for our final lit review project. So basically, we just got to try and come up with a question that we want to focus on, and we research it for the next 7 months and then present on it, kind of thing. So that's kind of what I've been working on recently. I'm leaning towards kind of going for a joint that I'm not super familiar with, pushing myself out of my comfort zone a little bit, which is going to be beneficial just in the sense that I'll learn a lot about one specific joint and get a lot more comfortable with it. And then ultimately that's just where growth happens, is outside your comfort zone. So I figured, why not? It's a good opportunity to not pick something that I'm already familiar with and go down another route. So I'm planning on something with a hip, and kind of look, just because the hip can be so complicated. Whether it could come from the back, it could come from lower, there's multiple different things in the hip. So that would be a good spot to kind of focus on. And I'm thinking somewhere along the lines of maybe labral tear, FAI, and comparing non-operative versus operative, and then taking it even a little bit further and comparing the different operative approaches, whether it's just like a straight repair or reconstruction, or just a debridement, that sort of thing, and kind of comparing those as well, with sort of the emphasis on athletes, weekend warriors, that sort of population, and their ability to return to sport and everything. So that's kind of something in the near future that's going to be going on. So that's kind of what's been happening the last couple weeks, months here.
Yeah, it's cool stuff. I being somebody who doesn't work in ortho and who's been in acute care for the last 3 months, FAI is a very just like abstract kind of like concept, and I think there was there a CPG for that FAI?
Yes, I believe so.
Yeah, like I know that I could go look that up, but like other than that, it's kind of like this abstract like diagnosis that like as somebody who hasn't looked at more ortho conditions, especially being in acute care, like people don't come in if they have FAI to the department. Or if they do, they're not admitted to the hospital for me to see. So that'd be a good. I feel like that'd be a good topic to just.
Yeah, it's definitely something that's very common, I would say, when it comes to the hips, or just not necessarily common, but something that's well researched. So it'll be something that'll be a good topic for me to kind of dive in, but then even go below the surface a little bit more. And I know it's something that is, like you said, with the CPG and everything, well researched. So hopefully I can be able to in the next, or that presentation isn't until end of August, so it's going to be quite a bit of research in between, but excited for that.
Yeah, that's cool. I've like so after we are done with this first rotation and we go into inpatient rehab, we start our research project. So I've been floating around a bunch of different ideas for that. I'm not going to bore you with them because I've talked to like 6 different people, and basically I did have one person, he's like, you do realize that if you do this idea, this is like what people are getting their PhD in, so you're not going to be able to do it, right? And I was like, I did not know that. But I guess I'll make another video for the channel, I guess, just kind of on my thought process, and kind of right now I'm in the process of narrowing it down because like I have a couple different directions I could go, and it's kind of just like what is feasible for somebody who's also working in the clinic and has other responsibilities, has no funding, but also still cool and interesting and kind of pushes the boundaries. But maybe we can talk about that on our next monthly reflection. So is there anything else that you want to share for the December monthly reflection as an ortho resident at Stanford?
I'd say one more thing that I'm upcoming that I'm looking forward to is tomorrow I start with my second mentor, my second content mentor. So, and she is excellent. She's kind of what everyone says is like the resident mom, kind of like how we at Ithaca we had Barb. This was like the Barb of Stanford kind of thing.
Okay.
So I'm excited for that, and she's just a phenomenal clinician. But her like main focus and main training is on movement, which technically as physical therapists we are experts in movement, but she has kind of taken that to the next level, and a lot of Shirley Sarman, who kind of came up with the MSI movement approach, she actually went to school, and she was one of her professors, and then she's just continued that on. So I'm really excited to spend the next, I think it's like 8-9 weeks with her, and really hone in my skills and my ability to really identify and pick out movement impairments, and understand why that's occurring, and then what I can do to fix that. So that's something I'm definitely looking forward to as far as this next upcoming couple months being with her.
Cool. Yeah, we have our live patient exam in, I think, a week and a half. They haven't told us the final date, the official date for it yet. So
nice.
I'm definitely nervous for that because having not really been in clinic a lot in December, kind of feeling like I'm getting back into the swing of things this week. But I'm looking forward to it. It'll be good. It'll be fun.
It's like riding a bike. It comes back.
Let's hope so.
Just got to get in the groove.
Yeah. So, all right, Zach. Well, thanks for coming on and sharing, your December reflection, and we'll have to do it again at the end of January. Happy New Year.
Sounds good. Happy New Year, everyone.